The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
Case counts at all-time highs, intensive care stretched to the limit, and everyone waiting, still waiting, for vaccines to put an end to wave after wave of this pandemic. Could the province's authorities have done a better job of rolling out the vaccines? Are they now on track? Tonight we'll examine that. Also, we'll hear from 3 Ontario mayors on the regional impact of COVID-19 on their communities. It's Monday, April 12th, and that's next on the agenda. Last week, the Government of Ontario issued its 3rd state of emergency and put the entire province under a stay-at-home order. It was needed, Premier Ford said, to allow the province's vaccination efforts to get ahead of rising cases and the highly contagious variants of concern. Ford has now pledged to get 40% of adults vaccinated by early May. Is that enough and soon enough? Let's ask. In London, Ontario, Maxwell Smith, bioethicist and assistant professor at Western University and a member of Ontario's COVID-19 Vaccine Distribution Task Force. In Mississauga, Ontario, Sabina Vora-Miller, co-founder of the South Asian Health Network and a founder of the website Unambiguous Science. And here in Midtown of the provincial capital, Maria Sundaram, infectious disease epidemiologist at ICES, formerly known as the Institute for Clinical Evaluative Sciences. She's also with the U of T's Dalla Lana School of Public Health, and I'm happy to welcome the 3 of you to our program today with an eye to figuring out how we can do this vaccine thing better and whether we're doing well enough as is. And to start our discussion, let's just play a little clip here. Here's Premier Ford last week rolling it all out. Sheldon, if you would.
We're deploying numerous mobile vaccine clinics in shelters, residential buildings, community centers, as well as churches, mosques, synagogues, temples, and other faith-based locations in the highest risk neighborhoods. This will include mobile vaccine clinics in high-risk workplaces that will remain open for the sake of our supply chain, starting with those in hotspot regions.
And those 18 and over living in what are considered to be high-risk neighborhoods are going to be able to get vaccinated once those mobile clinics are up and running. All right, that is a change of approach, a change of strategy from where we started once Ontario started rolling out vaccinations several months ago. And I guess I want to get a sense from all of you as to what we think. Maria, why don't you start us off?
I think this is a really great pivot. Obviously, there are clear reasons why we would want to prioritize older adults in the first phase of this. But now that we're moving on in this pandemic, the pandemic itself is changing, and we're seeing more infections and transmission events happen in high-risk areas among racialized groups, and specifically among essential workers. I am glad that this pivot is happening. I think it's definitely needed.
Sabina, how about you?
Okay, so in my opinion, this is what structural racism looks like. You see it playing out in the lack of access to vaccines and also lack of equity. We know that people who live in Jane and Finch, for instance, are 8 times more likely to be hospitalized or die due to COVID compared to those living in Rosedale, and 4 times less likely to be vaccinated. And if you look at data from ICES, this actually exists across every single age category. So it's not just due to the fact that in Rosedale you have more elderly population living. We know that from the science table that if you're prioritizing not just based on age, but also postal code, helps saves more lives and will also flatten the curve more quickly. We also have modeling data from Professor Colin that shows that prioritizing the essential workers are going to be offering protection to the entire community, including elderly adults. So absolutely, this should have been done. And in fact, this should have been done 2 months ago when we had this data available.
Sabina, I don't know whether you knew that we had the 2 parts of this province that you just mentioned ready to go in a graphic. If you didn't know, that is amazingly prescient. If you did know, okay, it's just rolling out according to Hoyle. Sheldon, you want to bring this up? I'm on the top of page 2 here because there have been these so-called vaccine deserts in priority neighborhoods, and this has come to light. And let's go through this. And for those who can't see this, who are listening on podcast, let me just take you through this. Is Toronto's vaccine rollout missing the mark? That's the question that's being asked here. And if you look at the neighborhoods where most vaccinations are taking place, in other words, vaccinated with at least one dose, Mount Pleasant and St. Clair, that's a fairly fancy neighborhood. Spadina and Eglinton, again, fairly fancy neighborhood. We're talking sort of a bit of Rosedale, a bit of Forest Hill there. Almost a quarter of people have had at least one shot, and the hospitalization and death rate is less than 0.5% per thousand, 0.59 per thousand. On the other hand, if you go to the least vaccinated neighborhoods, they are, you could say, the most racialized neighborhoods. Jane and Finch at only 5.5%, compared to almost a quarter in the other neighborhoods. Hospitalizations and death per 1,000, 5.06 at Jane and Finch in the northwestern part of the capital city. Kipling and Albion, which I think is in the Premier's own riding, 6.3% and 3.67%. Anyway, numbers which are starkly different from the better off neighborhoods to the so-called priority neighborhoods. And Maxwell, let me get you in at this point. What do you attribute that big delta in those numbers?
So there's a few things that we might attribute there. I think, first of all, to Maria's point, I think, the fact that everyone in long-term care homes and everyone over the age of 80 is at significant risk. And that's why there really was a blanket approach across the province in the beginning of this rollout to make sure we're getting all of those populations across the province. These disparities that we're seeing across the geography of Ontario is something that we heard from Ontario Science Table, and the task force really took that up and said we need to target those communities that do have higher risk of hospitalization and mortality. And so that's why we're seeing the plan focusing on younger ages in those communities at this point. Two other things that we need to think about when it comes to these disparities is uptake. On the one hand, we know that there tends to be higher rates of hesitancy amongst sociodemographically or socioeconomically disadvantaged communities. And we know that it's not just about the number of clinics. We need to get vaccines to people. And so that means making sure that we have mobile clinics actually going to the people that need the vaccine most, and making sure that things like work commitments don't prevent people from getting those vaccinations.
All right, none of those explanations that I just heard, and Maria, let me get you to follow up on this, none of those explanations I just heard suggested that the government of Ontario had an intentionally racist policy designed to prevent people in priority neighborhoods from getting vaccines that they need. And you know that that accusation is, quote unquote, out there. Are there other, more logical explanations for these numbers in your view?
I think it's important to note that just because something may not sort of have an explicitly racist intent does not mean that the effect is not racist. And I think Sabina was so right to mention structural racism. We're seeing, again, at Jane and Finch, we have maybe 6 pharmacies in a 3-kilometer radius in that neighborhood that are able to deliver vaccine. And then in Moore Park, it's 29. And this is not necessarily a conscious decision saying, well, we're just going to do less for Jane and Finch. It's years and years of sort of structural racism and inequality that's enabled the rollout to happen more easily in wealthier neighborhoods where COVID-19 is not as much of a problem. And so when we're enacting these policies, they really have to have, from the very beginning, an equity focus. Otherwise, we end up with this result, which is inequity.
Well, okay, Maxwell, let me go back to you then. I mean, can we say that it was a reasonable decision a year ago to put the priority on people living in nursing homes and long-term care homes, for example, even if they were not in priority neighborhoods, because they, after all, were dying in numbers disproportionate to everybody else? Is that a reasonable conclusion to come to?
I think it is reasonable. I mean, even with the rollout of vaccines into long-term care homes and high-risk retirement homes, assisted living facilities, they were prioritized in those communities that had the greatest outbreaks in the first place. So we have vaccinated 92% of all long-term care residents, 2 doses for all of those residents. But we did start with those long-term care homes that have been burdened by the greatest outbreak. So I do think that was a reasonable approach.
Sabina, how about you? Do you concur?
I absolutely think that we should have targeted the congregate settings, LTCs earlier, because we did see, the tragedy that was unfolding in LTCs and long-term care homes. However, what I do want to also highlight is that what we're seeing in ICUs is running in parallel to what occurred in LTCs. In ICUs, we're seeing generally younger, racialized essential workers who are being admitted into the hospital. Very often, they're actually members from the same family that are being admitted together. And we're seeing more and more younger people that are filling our ICUs right now. So remember that mortality is not the only thing we need to be looking at. The long-term health effects and impacts that people are going to have with long ICU stays, being on ventilator for a very long time, the decomposition that's occurring, these are all things that we need to be considering as well, because it's going to have a lot of long-term downstream effects on people. So absolutely, I think that once we had targeted the LTCs, we need to be pivoting really quickly and moving towards trying to target the essential workers that we know. We've been in lockdown. I live in Peel. I've been in lockdown since November. So clearly what we're doing so far is not working, because we're not actually trying to stamp out workplace transmissions. And this is occurring because, we don't have workplace protections. We don't have sick pay. And at this point, we also don't have an equitable rollout in terms of vaccines.
We're going to get to those issues in just a moment, but I'm not quite finished here yet. Maxwell, how do I put this here? There's not necessarily a cause and effect between A and B, and I put that on the record here just because I'm about to ask a question about whether or not you think the departure of General Rick Hillier at the end of last month has anything to do with the change of approach that the province is apparently now taking.
I wouldn't say so at all. This was a plan to focus on these so-called hotspot communities at least a month or two ago. The Science Advisory Table had produced some really nice evidence suggesting that there are communities that have much higher risks of hospitalization mortality. And from the get-go, the task force has been committed to saying, if we're focusing on those that are 70 and above in the entire province, we need to be focusing on those younger populations as well in those hotspot communities, just because of the increased burden that they're experiencing.
Okay, Maria, this does raise some issues about, our entire discussion today about who gets the vaccine when, how old you are, where you live, how high a risk you are, and so on. And obviously, there have been many people who've come forward so far and criticized the order in which some people have been vaccinated. For example, and in the interest of full disclosure here, I'm in that 60 to 64 age group, so I got an AstraZeneca, the first shot, in my view, before some other people who were probably much more worthy of getting the shot, like people who worked in, in Amazon or in trucking in Brampton or something like that. I got a shot before some of them did. Now, on the face of it, that may not make sense, but is that just what you have to put up with when you're trying to take on something this big and complicated?
I think what you described is an example of how it's very challenging to incorporate an equity lens into vaccine rollout. So you probably were a little bit more accessible to the vaccine rollout plan than many people who, for example, work at Amazon or other big box stores, meatpacking plants, high-risk transmission environments altogether. The other thing is that younger people are usually the people who are essential workers, they're hourly workers, they may be teachers. These are people who have kind of unique workplace transmission risks, and because of their age have been deprioritized. So, just as Sabina said, it's really helpful for us to now make a very quick switch, because, we're seeing that the pandemic is no longer the SARS-CoV-2 that we know and perhaps tolerate, hopefully not, since last March. It's now a pandemic of variants. It's really, really crucial that we take that into account. The pandemic is also changing. We need to pivot our policy to make sure that we're addressing those issues, including making sure that we get to the people who are hardest to reach for our inequitable system. All
right, Sabina, let me get you to follow up on that in this regard. There have been, of course, a lot of complaints about confusion. People didn't know, if you're doing it by postal code, some people don't know what their postal code is. Other people don't know whether you have to make an appointment, and if you do you have to make a follow-up appointment, or do they come to you to make sure you get that? Anyway, there's a lot of confusion out there. Is there a structural reason behind this apparent confusion?
So I definitely think that, having these multiple streams has been very confusing. You have, as you said, you have the provincial portal, you have each PHU has their own portals, hospitals have their own portals, and also their own criteria. And then, of course, there's that pharmacy arm. It's very confusing because every single one of these arms has their own criteria, their own set system that you have to navigate. And, through the South Asian Health Network, we've been doing several town halls, vaccine education, and where do you get your vaccine town halls for our communities. And a lot of our questions are not just based on hesitancy. In fact, it's based on how do I get my vaccine? How do I actually get my parents to get their vaccines? And people are having a very hard time trying to navigate the system. There's a lot of digital literacy, in place that is being a barrier. There's also language that is being a barrier in here as well. So absolutely, I feel like that the system could have been made a lot more easier, and we should be meeting people where they are. And so, the only way we can actually have a successful vaccine campaign is if we actually remove every single barrier in place. And we're still struggling, I think, with that because people are confused.
Maria, two quick follow-ups on this, and let's see if we can eliminate some of the confusion here. Again, because of reports coming out of Europe regarding some women on an AstraZeneca shot, they develop blood clots. We've had no cases of that here in Canada, to my knowledge. But what's your advice to women about whether they should get the AZ shot here?
So my advice is follow the NACI guidelines, which say that if you're 55 and up, regardless of your sex or gender, the AstraZeneca vaccine is a good choice for you. And the reason why I'm so confident about this is that, at the age specifically of 55, we're seeing that not only is there a huge reduction in risk of these extremely rare events, but also there is an increase in risk of these really bad outcomes for COVID-19, including blood clots. For example, if you have a COVID-19 infection, your risk of a blood clot, like the one that's being described, is 1 in 200. And kind of at baseline, it's 1 in 1,000. For this vaccine, these events sort of across all age groups are quite rare, but the risk-benefit calculation for adults over 55 is very clear. I would feel very comfortable recommending this to my family member or my friend who's 55 and up.
All right. And Sabina, pregnant women, what's the advice to them?
Okay, so you have to remember that in pregnancy, clinical trials never, for any vaccine or any medication, clinical trials simply don't include pregnant women, right? And so what we need to understand here is that in every single situation for a medication or vaccine, we have to do an individual risk-benefit analysis. So NACI and SOGC have basically said that the COVID vaccine should be offered as long as a risk-benefit analysis has been done. And remember that when we're talking about risks over here, we're also talking about risks that COVID-19 infections themselves have in pregnancy. The other thing that I also want to tell people is that, we are having more data coming out from real world. We have a pregnancy registry that is done by the CDC that so far has shown no negative effects of the vaccine in pregnant people. And second of all, I think also there might be a small benefit here in terms of passing passive IgG antibodies from the mother to the fetus. And so, absolutely, risk-benefit analysis is important, making sure that you're having those discussions with your physician. But the way NACI and SOGC, which is the Society of Obstetrics and Gynecology of Canada, has said that the vaccine should be offered as long as the benefits outweigh risk for the patient.
Very good. All right, Maxwell, I'm going to get you back in here now, and we're going to bring up another graphic which will compare. How do I set this up here? Okay, Doug Ford and Justin Trudeau were having quite the food fight last week because it was an argument about, I don't have enough supply. Well, no, not true. We've given you enough supply. You just haven't managed it properly. Okay, here's the chart. And again, for those listening on podcast, I'll take people through this. This is comparing Ontario's vaccine administration, in other words, getting needles in arms, with the distribution of the actual doses. And we're comparing a period from last December to basically present day. And initially, of course, there was not very much supply and therefore not very much going into arms. But those numbers were pretty close together. In other words, when the feds got vaccines to the provinces got the jabs into people's arms. But as time has moved on, say from March 10th until today, there is a clear break where there are a lot more doses going out, but they are not getting into people's arms quickly enough. And the gap there is more than 1 million by April the 9th. Maxwell, the number I have here is that 77.9% of available vaccine doses in Ontario were actually used by the end of last week. 77.9%, which means there's almost a quarter of the doses that are still sitting in a freezer somewhere, presumably, and have not yet been used. Why would that be?
So I think there's a couple things to note there. So first of all, if you look on any given day of how many vaccines haven't been administered as compared to those that have been delivered, we have to look at when those vaccines were actually delivered. We're getting those in weekly shipments. So of course, if we receive 1 million doses yesterday, then it wouldn't be surprising to see a gap of 1 million doses today. The other thing that's worth noting is that we see constant delays in vaccines, unexpected delays of when they're actually going to arrive into the province. And that means that if we don't get the vaccines on Monday and they end up coming on Thursday, that we'll have 300,000 or 400,000 vaccination appointments that will not be able to be honored. And so having around 3 days of vaccines to be able to use for those in case there is a delay is prudent. And that, given that we're doing around 100,000 vaccines a day, would end up being around 300,000 vaccines if we wanted 3 days contingency. The other thing that I'll note is that that figure of 77.9%, while it does show that there is a gap between that and 100%, it is the second highest administration across the entire country of all provinces and territories, save for Saskatchewan, and is comparable to that in the United States, which is a paragon for vaccination administration.
So don't compare me to the almighty, compare me to the alternative.
Well, I think we need to look at what's feasible. Absolutely, we want to be vaccinating as many people as we possibly can and administering every single dose that we get. But if we want to look to Ontario to say, are we failing as a province, I would say this appears to be the norm across every other province and territory, every other state in the United States, and every other jurisdiction that is doing this.
All right, let's move on to the Ontario Liberal leader, Stephen Del Duca. He had a news conference earlier today in which he called for all education workers, period, full stop, not just those in hot zones, but everyone to be vaccinated. And the thinking was you could get it done this week because, of course, this is March break week. Even though it's not March, it's April, but it's March break week. This is the week the kids are off. When it comes to, Maria, I'll get you to start on this one. When it comes to protecting teachers, students, caretakers, principals, everybody in the school system, what's the best way to do it now?
I think this is a great opportunity to use empty schools to vaccinate teachers. We've seen that work in other provinces and also across the U.S. as well. I am concerned about the length of time that it's taken to get vaccines to teachers, given that there isn't a province-wide policy for schools to be closed right now. So this is very, very concerning, especially in the context of this exploding number of variants of concern. We're starting to see that that is affecting children in other areas, in Israel and Italy, across the U.S. as well. And so I don't think we can sort of look at the data and say, historically, throughout the past year, SARS-CoV-2 hasn't affected children, so that's okay. We're not going to prioritize schools. Right now, we have a pandemic of variants. So it is really, really important that we focus on teachers and everyone else that works in a school.
Sabina, is it possible to get everybody during this week when the schools are shut down, to get everybody who needs a vaccination vaccinated?
Okay, so the virus works 24/7. It does not take a break. And so our response has to be immediate. It has to be urgent. Every vaccine that's sitting in a freezer right now that is not going in someone's arm is a life that could be saved. So absolutely, we should be doing everything. We should be having 24/7 clinics, and we need to be vaccinating as fast as we can.
All right, let's move on to long-term care. You may know the National Post columnist, Financial Post columnist Diane Francis, who did a piece recently on whether the vaccine should be mandatory for those working in hospital and long-term care homes. And here's a little of what she wrote a few days back in the Financial Post. She wrote, "Governments cannot allow worker rights to trump patient rights. All public-facing healthcare providers should be required to be vaccinated under the threat of termination. Care homes should also require all staff and contractors to be vaccinated as a condition of their employment. The healthcare system is supposed to look after the sick and the vulnerable, but it can't do that if reckless medical professionals are exposing patients to COVID-19. Okay, Maxwell, do you agree or disagree with what she has suggested ought to be done here?
Yeah, I think mandates for vaccines can be ethically justified. Of course, we have them for schools in Ontario. When I worked in hospitals, I had to show that I was vaccinated against certain pathogens. I think that we need to certainly think about the balancing between public health benefits and individual freedoms. In the context of healthcare, I think we need to think about what the implications of this might be. Of course, we're not forcing anyone to become vaccinated. We're making vaccination a condition of employment, or that you'll have to work in perhaps a less risky area if you're not vaccinated. And given that our system is already under such strain, I worry about the attrition that we might see with such a policy, and if that would end up straining the workforce even further. So I think it can be ethically justified. We just need to think about the consequences of what a policy like that might look like.
All right, fair enough. And let me put, Maria, to you another issue that Diane put on the table, which is, in her view, our politicians have made a political rather than a scientific decision to have the second shot that people get, for those who need the 2 shots, to have the second shot taken as much as 4 months after the fact, when, in her view, science says you should be getting that second shot not nearly that late. It should be sooner. But because we're trying to cover more people sooner rather than fewer people more efficaciously sooner, we're going up to 4 months now between first and second shot. Are we asking for trouble here by doing that?
So I think this is a good example of, we have to remain resilient to changes in the pandemic and in our policy. We can't expect that the rollout looks exactly like a clinical trial. So in the clinical trials, we have data that say, you should get the second dose perhaps 21 or 28 days after the first dose. And that makes perfect sense. That's kind of what I was on board with at the very beginning. I was like, we should absolutely have this be exactly the same as the clinical trials. But now that we're seeing more data come out about the effectiveness of just 1 dose, it sort of makes mathematical sense to instead of vaccinating 100 people with a 95% effective vaccine, vaccinate 200 people with an 85% effective vaccine, right? If we have vaccine rollout challenges like we do have right now in Canada, this is a good way to try to prevent as many illnesses and deaths as possible. But my question is, are we kicking the can down the road? 4 months from now, are we going to have enough vaccine to make sure that everyone gets their second dose? And that is a real challenge for me, because I think we've seen several instances where the rollout system is not resilient to changes in supply, changes in demand, changes in where the vaccine needs to go, and it's not agile. And so I think we really need to apply the force there and make sure that we're resilient to these changes as well.
Yeah, if we don't have product in 4 months' time, that whole strategy's for naught, isn't it?
Right, exactly.
Okay, moving on. We got about 5 minutes left here, and let's see if we can get a couple of more things in. Sabina, this to you first. As of this past weekend, Ontario is lagging behind, apparently, BC, Saskatchewan, Nova Scotia, and Quebec for the percentage of the provincial population which has received at least 1 dose of the vaccine. And Canada is apparently lagging behind 17 other countries for total doses delivered. The United States leading that pack. And here's Tracy Lindemann's Atlantic article on Canada's vaccine rollout. Tracy writes, through a combination of bureaucracy and legislation, the country has slowly lost its drug manufacturers that were doing original R&D, its capacity to respond to potential pandemics early, and its federal clout in organizing national strategies for pandemic response and emergency vaccine rollout. In short, it's a hell of a mess, decades in the making. The blame, though, has fallen squarely on Justin Trudeau in his 6th year as Prime Minister, who is now tasked with cleaning it up. Tracy Lindemann in The Atlantic from last week. I guess, Sabina, I should just ask you, do you think that's a fair characterization of where things are at?
Yeah, so, I think that because we don't have any national production and manufacturing of vaccines, there's a lot of sharp elbows that is going around globally with respect to nationalization of vaccines. And we're going to see that play out every time there's a pandemic. So absolutely, we need to be building capacity here in Canada. But the issue is that this is not something that can be done overnight. These are things that take years in the making, in fact. And we did have some really good capacity to manufacture drugs and vaccines here that was essentially completely decimated in the last 10 plus years. To build that overnight is impossible, and we absolutely should be. And we're going to see more and more pandemics occurring. We need to be ramping up our production in home so that we don't actually run into the same issue again, because we will see vaccines constantly be the nationalization occurring with rollout of vaccines.
In which case, Maxwell, and just finally, are we doing what we need to be doing right now to have the best possible results given where we're at?
I think we are. I think obviously there's always challenges to make sure that those priority groups that we're focusing on have equity of who's actually getting the vaccine. And Sabina and Maria have mentioned, really looking at the evolving evidence and pivoting as quickly and effectively as possible to make sure that the harm-reducing effects of those vaccines are being deployed where they will have the best effects.
Very good. Maxwell Smith, Sabina Vora-Miller, Maria Sundaram, this was really helpful. Thanks for spending so much time with us on TVO tonight. We're really grateful.
Appreciate it.
Thanks for having us.
Tomorrow on the agenda.
You might assume from this idea that we're talking about just a handful of men, but we are actually talking, even within the incel community specifically, about groups that number in the hundreds of thousands, about forums with millions and millions of threads and comments and likes, about videos with millions of views. And we're talking about men who have gone offline and acted in the name explicitly of this ideology, men who have carried out massacres, mainly of women, in the name of this hatred of being incel, of the idea that women owe them sex and deserve to be massacred if they haven't given it to them.
That's tomorrow on the agenda. While the whole province faces the same stay-at-home order today, not long ago, some cities had glimpses of normal, such as indoor dining and haircuts. With us now on how the return to lockdown is playing out, we've got 3 different regions of Ontario represented, and as is our custom, we'll introduce them from furthest away to closest to our studio, starting with Bill Morrow, who is the mayor of Thunder Bay. He's in northwestern Ontario. Bernadette Clément is the mayor of Cornwall in eastern Ontario. And Tom Maracas is the mayor of Aurora in York Region in the Greater Toronto Area. And your worships, good to have you all on our program tonight. I want to start by bringing up a graph which indicates in your respective regions what COVID-19 has been doing over the past year in terms of new and active cases. And for those who are listening on podcast and who can't see this, let me just describe it in some detail. We've got 3 lines, 3 different colors. Thunder Bay is the gray line. And as we look at that one, that has been fairly steadily under control for most of the past year. A bit of a spike in March, but otherwise, relatively speaking, under control. We'd say the same thing about the blue line, which is Eastern Ontario. A bit of a heartbeat there as we've come into 2021, but essentially under control. But then York Region, which is the orange line, a huge spike in January, then brought back down under control by March. But in April, that line is pointing towards heaven. So, Mayor Maracas, I've got to get you in here first. Why does it appear as if COVID-19 is out of control in York Region right now?
Well, Steve, I think ultimately what we're seeing is that the areas that there is a high transmission rate really hasn't been solved. I mean, 44% of workplace outbreaks are happening in our manufacturing sector, yet they're still open. And so that's why there's a big push as far as taking an aggressive, targeted approach to vaccinations and looking at getting in there and vaccinating those in the manufacturing sector and all of our essential workers, because we need to curb the cases that are just continuously growing at this point.
Mayor Clément, what's the story in Eastern Ontario where you are?
So as the line shows, we had a pretty good run up until Christmas. And then since Christmas, it's been a real struggle. And this third wave has really sent a little bit of a shock wave through our community. And we're being told by our hospital CEO that the hospital is now sending patients to hospitals outside of our area, because they need to be able to manage the influx of cases, COVID cases. Our hospital in Cornwall is the regional COVID hospital for Eastern Ontario in Stormont, Dundas, Glengarry, and Prescott Russell counties. And so it's important that the Cornwall hospital be in good shape, and we're being told that it's not.
Mayor Morrow, how are you managing in northwestern Ontario?
Well, we are, as we speak, Steve, in a much better place today than we were 2, 3, or 4 weeks ago. 2 or 3 or 4 weeks ago, I think we had the highest incident rate in the entire province of Ontario. That's referenced in the spike on your graph that you put up on the screen a little while ago. And so since then, our numbers have greatly improved. They are seeing a downward trend over the last 2 to 3 weeks. That is very encouraging. However, I think the caution, certainly for me as mayor, and I think for the entire district of our health unit, the variants are here, but they have not yet spread to any great degree. We all appreciate and understand that they are considered to be and are much more infectious. And so for that reason, I remain very cautious in terms of what we're going to see over the next couple of weeks.
There's always a question when a stay-at-home order is brought in by the province, across the whole province, whether that's the right way to go. And Mayor Maracas, I'll get you to weigh in on this. You know, whether you're a community of 2.5 million, as the capital city is, or 100, like Kagawang on Manitoulin Island, it's the same approach. In your view, is that the way to go?
Personally, I don't. I think that I think from a GTHA perspective, I think we need to look at it as a whole and as one unit because we are so close and people are constantly moving from one region to another. You know, as far as for work purposes or just trying to get vaccinated. But in northern regions and more rural settings, I don't think that they need to be put into the same circumstances as far as the whole GTHA. So I don't think it's a one-size-fits-all approach. And you know, I really do wish that the province would look at that and maybe kind of you know, make some adjustments to this, because I think it's unfair to those rural areas that are not seeing a high number of cases and for all their businesses and everyone to be shut down.
Do I infer from your comments that you don't think there should be a lockdown order in Aurora right now?
Well, no, I think that Aurora, because we're part of the whole GTHA, I think that we need to move forward as one unit. So no, I do think that we do need to be in a lockdown right now, but I do think that it needs to be looking at all sectors and creating a level playing field so that it's not just penalizing or punishing one specific sector where we're not seeing the transmission occur.
Okay, Mayor Clement, how about you? In Eastern Ontario, do you think the one-size-fits-all approach makes sense where you are?
Well, you know, the conversation changed this year. Last year and last summer, our numbers were good, and we were feeling a lot more confident. Right now, and the way that our geography works is we're quite on the border with the U.S. We're also on the border with Quebec. We're also close to the Ottawa region. And so at this point, with cases rising all around us and here in Cornwall, I think we have to be following the rules as much as possible along with this current lockdown to get this thing under control now. You know, we see the light at the end of the tunnel, but we have to stay the course. And so right now our community is struggling to follow the rules as much as we can to get through to when we can all get access as much as possible to vaccines.
Mayor Morrow, the lockdown in Thunder Bay, people accepting it there?
I think, Steve, generally it's fair to say they're accepting it. But again, you know, this is about the variants. If the medical advice is that the lockdown stay-at-home order is necessary to contain the variant, if that's what's driving the current policy position, then I think we can all accept that. But I think if that is what's driving the policy decision that the province has made, then it needs to be tied to very closely the vaccination plan rollout. Because if Thunder Bay, with our numbers going down significantly over the last 3 weeks, is included in this pan-provincial lockdown because of the variant's potential, you know, increase in the numbers, then I think that we need to be accommodated the same when it comes to the vaccination rollout across the province.
I'm going to play you a clip now, Mayor Morrow, of a guy that we had on this program on budget night. You may know him, Tony Muya, who has a hair salon in Thunder Bay, and he says the past year has been absolutely and utterly devastating to his business. And, well, he had some advice for folks who do what you do for a living. So let's listen to that clip and then we'll come back and chat. Sheldon, if you would.
It's been absolutely catastrophic, not just business-wise, but personally. What's happened for us is our numbers are so far down, it's crazy. What's worse, more than our numbers being down, is what the Ontario government has done to really ruin the importance of being a hairstylist or a spa technician in Thunder Bay. We are only 4 different businesses that are still closed in the gray zone. So many of my friends and I, we walk around and think, you know, we're almost better off dead than we are alive. We're worth more dead than we are alive, like the movie It's a Wonderful Life. It's sad.
That is quite a stark and shocking thing to say, but that's how Tony felt on budget night, and I suspect he feels the same way today. What do you say to business owners who believe they can reopen, they've spent the money to take additional protocols and precautions into account, and believe they can open safely and try to recapture some of their livelihood? What do you say to them, Mayor Morrow?
Oh, I think they're absolutely right. I do think there are a number of small businesses, hair salons, and private gym owners who feel they have been unfairly captured in the rules as they have been rolled out over the past number of months. I do know Tony, and I have talked to him directly on at least a couple of different occasions. I think, though, that as they are caught up in this, the province, if they're going to close down the entire province, they need to be accommodating these small businesses with whatever support programs they need to keep them whole and to help to bridge them through the pandemic. I would say something about Tony and others like him. Some of them who I've talked to, Steve, have been very clear. They are willing to still be in this position. Perhaps that's a bad choice of words. They understand why they might have to be in this position, but what they really wanted was to see a leveling of the playing field. They wanted to ensure that a lot of businesses who are still being allowed to operate unfairly, according to them, were gaining an advantage where they were being unfairly advantaged by having to be locked down. They were looking for a leveling of the playing field. That's language that Tony has used with me directly. And so to their credit, they understood that if they were captured in a lockdown, they thought that other similar industries and businesses needed to be treated the same. And so to their credit, they've acknowledged that directly to me. Having said this, this goes back to your original question about whether the pan-provincial lockdown is the right thing to do, when Thunder Bay's numbers right now might put us in what would be considered the old red range, right? Where a number of businesses like Tony's and gyms and hair salons would be allowed to operate. The province has gone away from the color-coded piece. They've gone to a pan-provincial lockdown. And again, back to my original point, I have to believe it's because they're believing that variants are going to cause spikes even in regions that are currently seeing relatively low numbers. I tie that back to the point I made earlier, then you need to be distributing the vaccines on a proportional basis.
No, I take your point, but Mayor Maracas, what do you say to your small businesses in Aurora when they say to you, how come Costco's allowed to be open? How come Walmart's allowed to be open? I'm losing all my customers to them. I have to be shut down. This ain't fair. What do you say to them?
Well, that's been the frustrating part about this, Steve. I mean, we've advocated for a long time, I think since day one of this pandemic, is to create that level playing field, and to say to the province that if we're going to continue to need these lockdowns to bring the case numbers down, so that way we can take the burden off of our ICUs, then it needs to be done in a fair and equitable way. And so, that's what we've seen with this stay-at-home order now is where they've removed your Costco's, your Walmart's from being able to sell goods that are not essential. I think that's kind of leveled the playing field to a certain way for some of these small businesses to look at and say, okay, listen, if this is going to be the last lockdown, if this is going to be it, then let's have that level playing field. Let's get through it. Let's get beyond this. But I'm going to go back to the fact that we need to take that opportunity now, while we're in this stay-at-home order, and get the targeted, aggressive vaccine rollout out and get it into those hotspots and get it done. Because I can tell you, without that being done during these 4 weeks, it's going to be all for naught.
Mayor Clément, how big an issue is this big box stores versus small businesses playing out in Cornwall?
It has been an issue throughout the pandemic, and I know that our council has discussed it and made motions and sent those to the province to make sure that was being recognized. I do want to say that that story of the hairstylist is heartbreaking, and ones that are here too. The information from this latest lockdown, when that came through, I got a text from a hairstylist saying, I don't know if I'm going to be able to survive this. But at the same time, she's listening to information that's telling us that 70% of our cases in this area, this is information from our medical officer of health, are variants. So I think small businesses are suffering, and our community wants to support them with gift certificates, with curbside, as much as possible. But our community also understands that, we may start to have to advocate for ourselves as a hotspot, so that we can get better access to vaccine quicker, because our population is vulnerable. And so it's been difficult, very difficult for small business. I can say that our city rolled out small business loans very quickly early on in the pandemic last year. And you're now relying on the province and the federal government to support small business. so that we can hear fewer of these very heartbreaking stories that affect us all and affect the mental health of not only those business owners but many community members.
Mayor Marakis, let me just let me do one more follow-up on this, and that is, I was driving by Yorkdale last night, the shopping center, and the parking lot was absolutely jam-packed. I don't know what to say about that other than I know the Premier prides himself on keeping links between himself, his office, and you mayors strong. And I wonder if at any point you have had the conversation with him that goes something along the lines of, you're a small business guy, Premier Ford. How does this policy make any sense when the richest, biggest stores are allowed to be open and the people who actually coincidentally probably form much of the base of the PC party in this province are not allowed to be open and are going out of business? And as we heard from the hairstylist Tony in Thunder Bay, the last budget was not all that helpful, or not helpful enough in his view to his needs and aspirations. What do we say about all that?
This is the frustrating part. I think from our businesses, they're losing their livelihoods. I mean, we're seeing it in Aurora and a lot of small urban centers where their downtown cores, their shops are closing up. They're just dropping their keys and they're walking away because they can't continue going on this way. And we've relayed this message time and time again to the Premier that if we're going to do a lockdown, if this is what we need, if this is what the science is telling us and the data is providing us that we need to shut this down, well, then let's shut it down. It's, these half measures are not being productive and they're not helping our local economy. The way we look at it is you either open it up or you shut it down. This right now is not truly a shutdown because as we're seeing is a lot of those bigger places are allowed to stay open and they're seeing record profits.
Mayor Morrow, tell us about, because we talked earlier about the fact that you did have a spike in cases, which was very significant a few weeks back, but then the line on the graph did go down again. You did get it under control. How did that happen?
Well, the spike, Steve, I think it seems to be that it was connected to outbreaks in our correctional facilities. I can't say that with certainty, but it certainly seems to be a correlation, at least, between what was occurring in the correctional facilities and people being discharged, often, unfortunately, into homelessness, which led to community spread, which led to our spike. That piece seems to have worked itself through. I did make a call to the Minister of Health at one point saying, we have the highest incident rate in the province of Ontario, and yet you haven't declared us a hotspot. We need more help. We need more vaccine. We need to get this dealt with. And so over the past month or so, it more or less has resolved itself. I think that we have received for a period of time, I can't say how much more or for how long, we did receive a bit more vaccine, I think, for 1 week or so, which would have had a positive effect. And so we are seeing the numbers going down. But as I mentioned, we may be seeing the numbers going down now, but the variants have not yet arrived in any significance. They are here, but the community spread has not yet occurred. Going back to the previous discussion, this may be why the province has done a pan-provincial lockdown. And so they've gone off script from the original plan that was rolled out by General Hillier, that there would be this color-coded scheme. If you're in red, you could do A, B, and C. It goes back to the earlier discussion. Our numbers would now probably have us in red. Hair salons would be able to be open. Private gyms would be able to be open, but the province has made this decision to go pan-provincial and gone off script when it comes to the original color-coded plan.
Okay, back to Eastern Ontario. I want to ask you, Mayor Clément, about your hospital, because I'm told that as of last Thursday, the Cornwall Community Hospital was caring for almost 30% more patients than it has beds. And as you told us earlier in the program, you're starting to see patients now being transferred out of the region in order to get care. The CEO of the hospital apparently thinks this is going to get worse before it gets better. Any sense about how this happened?
Well, it's the variants. Clearly, after Christmas, we saw definitely a spike in cases, and there was a lockdown, and that seemed to be effective. But now we're being told that, as I said earlier, 70% of the cases we have are variants. The transmissibility is quite shocking. And so this is where we are. And we called a special council meeting last week to speak to our MPP, and more importantly, even our hospital CEO, Jeanette Dispati, who gave us some stark numbers. It's unprecedented. She's the word unprecedented. And she has been CEO for a number of years. She has wisdom and experience. And when she says that, we sit up and listen. And so our community now is focused on following those rules, following those regulations, and advocating for ourselves as a hotspot, getting pharmacies online so that more and more people can get access to the vaccine. That's where we are. And it's very concerning to hear a hospital CEO tell her community that the hospital is in trouble, that healthcare workers there are, in danger of being burnt out, right? And we are the regional hospital for Stormont, Dundas, Glengarry, Prescott, Russell for COVID. So we need help here, and we need access to more vaccine, more resources. And we need everybody to get on the same page with messaging. I don't know how many people the other mayors are talking to, but people are tired. They're also tired of not understanding the different color codes and what's going on. We need clarity of message right now.
Mayor Maracas, I see you nodding your head. You're not seeing a clarity of message coming out of the province?
No, you know what? Actually, I don't think it's just the province. I think it's all levels of government. The messaging is all over the place, and I think that everyone needs to start to take the politics out of it. Doesn't matter whether you're conservative, liberal, green, NDP, Bloc. You know what? We need to all work together at this point. Get the messaging out that it's clear, understandable, because that's the frustration among what I'm hearing among residents, especially when you're talking about the vaccine rollouts. Here we are, we have the province on one hand saying, listen, we're gonna open it up and we're gonna start vaccinating hotspots and we're gonna start with the essential workers. And yet here in York Region, we're shutting down 2 clinics today. So when people hear that, they're like, well, what's going on? And so, you have the Minister of Procurement at the federal level saying one thing, you have the Premier saying something else. You know what, guys? Put the politics aside. Let's get some accurate information out there and let's stop with the aspirational statements.
Let me do a follow-up with you, Mayor Maracas, and that is for people who don't know the Greater Toronto Area, maybe watching us from other parts of the province, the city of Toronto itself, and then York Region where you are, essentially, Steeles Avenue is the dividing line. So when you're south of that line, you're in Toronto. When you're north of Steeles Avenue, you're in York Region where you are. Was it, in fact, the case before the province-wide shutdown was imposed that if people living in Toronto under lockdown wanted to get a haircut or wanted to do some shopping or whatever, would they come to York Region to do that? Did you see lots of evidence of that?
I think we saw it more in the south end, so in your Markham, Richmond Hill, and Vaughan. Not so much in the northern part of the region. Ultimately, if they came up, they would, but we didn't see as much in the northern part, as I said. But I mean, it was recommended that people do not region hop, and so there was that push to try to tell people, listen, stay within your own region. Regions were in different color codes, maybe, and that's what the ultimate push was, to create a province-wide stay-at-home order, was because they were seeing some of that region hopping occurring, especially with it between Toronto and New York Region.
Understood. All right, in our remaining moments here, let's go back to northwestern Ontario and figure out how well, Mayor Morrow, do you think the vaccine rollout is working in your neck of the woods?
Well, Steve, I think for me, this is the central point that I'm sort of focused on now. We were on an Ontario Big City Mayor's call earlier this week. We had an emergency meeting, and Mayor Maracas was on that call, I believe, and he would have heard me advocating for a proportional rollout of the vaccine across the province. So if you believe that the province in its entirety needs to be locked down and affecting those small businesses that we were talking about, not staying in the color-coded range, then it would seem to me that's being driven by some medical opinion related to what may be happening with the variants. And if that is the case, then the vaccines need to be rolled out proportionally. People in my region, in Thunder Bay, and our district health unit are seeing age groups as young as 18 having access to the vaccine. They're seeing other populations online being able to book an appointment for 50 and older. And so many of the other areas are not there yet. So it begs the question, why then would we all be considered to be locked down and those businesses not be allowed to open? And so for me, that's fundamentally the key. I can understand and appreciate we need to follow the medical opinion. That's important. If that's the case, say so very clearly, and then roll out those vaccines proportionally right across the province.
Mayor Clément, what do you need tonight right now from the province?
Definitely clarity of message, definitely support for our region being a hotspot so that we can get more vaccine. The city has supported the health unit throughout this process. Our paramedics are on duty. Our social services staff are there to support the vaccination process. Our arena is in play as a mass vaccination clinic. And so we need all the players to work together to make sure that people have access to as much vaccine as possible. We also need to target essential workers. I'm getting messages and messages from teachers, from the workers at our distribution centers, from healthcare workers. You know, they want to make sure that essential workers are also being targeted. So we need a targeted approach. We saw that that worked for people in long-term care facilities, and we need to have the province continue with that approach and make sure that municipalities are part of the process. You know, we don't have the jurisdictional decision-making capacity, but we do have resources and expertise, and we want to support the province and the health units whatever way we can to make sure that our populations have access to vaccine.
Mayor Marakis, I'm down to my last 30 seconds, and I'll ask you the same question. What do you need from the province right now?
I'll be quite simple: vaccines. That's it, clean and simple. But we need vaccines. We're running at York Region. We're running at a 33% capacity. We can do much more. All our municipalities. I know my mayor colleagues here today. We'll all say the same thing. We can get them in the arms of the people that want those vaccines if we have the supply. Get us the supply, we'll get the job done.
That's Mayor Tom Marakis, the mayor of Aurora, along with Bernadette Clément, the mayor of Cornwall, and Bill Morrow, the mayor of Thunder Bay. We're grateful to you three, your worships, for joining us on TVO tonight, and good luck.
Thank you.
Thank you.
Merci.
And that is the agenda for Monday, April 12th, 2021. Paid sick days is an increasingly hot topic in the province. We'll get up to speed on that tomorrow. Also, Nam Kiwanuka talks to author Laura Bates, who spent 2 years undercover among so-called incels to understand the online movement of extreme hatred towards women. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is brought to you by viewers like you. Thank you.